All right, let's talk about a real heavy hitter in the world of psychiatry, haloperidol. This is one of those medications that, it completely changed the game, but it also came with a really serious, profound cost. It's a powerful drug with a, let's say, very complex story. And that really brings us to the central question we're tackling here. What happens when something that helps so much also has the potential to cause its own huge challenges? That's the dilemma at the very heart of haloperidol's legacy. It's this classic balancing act, immense benefit versus significant risk. Okay, so to really get a handle on this, we've got to go back. Let's set the stage a bit. To understand just how big of a deal haloperidol was, you really have to picture the world it was born into. We're talking about a time when the options for treating severe mental illness were, well, they were incredibly limited. So what is haloperidol exactly? Well, it's pretty much the quintessential first-generation antipsychotic. It came on the scene back in the 1950s, and man, it quickly became a cornerstone treatment. And that's because of two really key things. It's super potent, and it's incredibly good at blocking a specific chemical in your brain called dopamine. And you have to understand, this was absolutely revolutionary. For the very first time, doctors had a tool that could actually target and quiet down those really challenging positive symptoms of psychosis. Things like hallucinations and delusions. This wasn't just another drug. It was real, tangible hope, a whole new path forward. So how does it actually pull this off? Let's get into the nitty-gritty, the mechanism. We're going to take a look at how haloperidol gets inside the brain and basically turns down the volume on all that neurological static. Okay, the main theory here is called the dopamine hypothesis, and it's actually pretty straightforward. It boils down to 4 steps. So, step 1. The problem. The thinking is that in psychosis, a key dopamine pathway in the brain is just way too active. Step 2, the symptoms. All that overactivity is what leads to things like hallucinations and delusions. So step 3, the action. Haloperidol comes in and basically acts like a roadblock, blocking these things called D2 receptors, where dopamine would normally connect. And then step 4, the result. With those receptors blocked, that dopamine static gets dampened and the symptoms start to fade. But wait. It's not just about dopamine. That's the main event for sure, but haloperidol also tinkers with a few other receptors, just not as strongly. For example, it blocks some alpha-1 receptors, which can make you feel dizzy, and it hits histamine receptors, which can cause a bit of drowsiness. What's kind of interesting, though, is that it barely touches these things called muscarinic receptors. And that's good news, because it means you get fewer of those classic, really annoying side effects like dry mouth that you see with other older drugs. Now, because this drug is so powerful and acts so fast, its usefulness just exploded way beyond what it was first designed for. Seriously, it's become this go-to tool for doctors in all sorts of critical situations, some of which might really surprise you. So first, let's look at the official, by-the-book, FDA-approved uses. Number 1 is schizophrenia. That's the big one. It's also fantastic for Tourette's syndrome. It's really good at calming down those motor and vocal tics. Then you've got its use for severe behavioral problems in kids, kind of as a last resort. And finally, it's used to get a handle on those acute manic episodes in bipolar disorder. Okay, but here's where its versatility really goes into overdrive. Doctors use it off-label for a ton of other things. It's a total mainstay in the ER for when someone is acutely agitated. It's used in the ICU to manage delirium. It can even work as an anti-nausea drug for chemo patients. And get this, it's even used for those stubborn, intractable hiccups that just refuse to go away. How wild is that? So we've got this super effective, super versatile drug. Sounds amazing, right? But here's the catch. That incredibly potent dopamine blocking power we talked about, the very thing that makes it so effective, well, that's also the source of its most significant and, frankly, dangerous drawbacks. And this is the other edge of the sword. There's no denying its power, but this medication is anything but gentle. There's a price to be paid for that power, and it's paid by the nervous system. We're talking about something called extrapyramidal symptoms, or EPS for short. And these are the hallmark side effects. You can almost see them developing on a timeline. Within just a few days, someone might get acute dystonia, these sudden, really painful muscle spasms. A few weeks in, you could see Parkinsonism, which looks a lot like Parkinson's disease. We're talking tremors, rigidity, that shuffling walk. And then the most worrying of all, after months or even years, is the risk of tardive dyskinesia. These are involuntary movements, like lip smacking, that can be permanent, even if you stop the drug.
And unfortunately, the risks don't stop with EPS. The problems are coming from a few different angles. Haloperidol can mess with your hormones by jacking up something called prolactin. It also carries some serious risks for the heart by affecting its electrical rhythm. And on top of all that, you've got other stuff like sedation and low blood pressure to worry about. And then there's the big one, the most severe risk of all, neuroleptic malignant syndrome, or NMS. Now, it's rare, thank goodness, but it is an absolute life-threatening medical emergency. We're talking a terrifying mix of super high fevers, severe muscle rigidity, and altered mental status. It demands immediate, intensive care. It's just a stark reminder of how serious this medication can be. So after all that, where does haloperidol stand today? Well, you can see it's a drug of two complete extremes, right? On one hand, it's immensely helpful, a lifesaver even. On the other, it's potentially very harmful. And that creates a really complicated legacy. So let's really weigh this out. In one corner, you have its power. It can get an acute crisis under control fast. It works on tough symptoms. And hey, it's been around forever, so we know it well. But in the other corner, you have the price, that high risk of severe, sometimes permanent neurological side effects, the fact that you have to monitor patients constantly, and the reality that for long-term therapy, it's largely been pushed aside by newer, safer drugs. And that really sums up the modern approach to using it. It's not a drug you just prescribe lightly. It demands real expertise. You have to pick the absolute right patient for it. You have to watch them like a hawk for any sign of trouble. And you have to have a deep, deep understanding of this delicate balance between its risks and its benefits. So in the end, the story of haloperidol really leaves us with this huge, fundamental question that goes way beyond just this one drug. It applies to so much of medicine. When you have a treatment that can literally save a life, but also has the potential to cause serious, irreparable harm, how do you make that choice? Whether you're a doctor or a patient, how do you weigh that? And honestly, there's just no easy answer to that question.